I'm Spotlight on America correspondent Angie Moreski. A lack of transparency in healthcare pricing has long been blamed as part of the problem driving up costs. New federal rules that took effect 5 years ago were supposed to give patients more power to shop around and stop them from being blindsided by big bills. But as we discovered, it hasn't worked out that way for many. Carrie Schrader is a dynamic 63-year-old former HR executive in Alabama.
I'm an educated consumer. Did not work in this circumstance at all.
When Carrie needed a muscle biopsy to address some weakness issues, she scheduled it a month out and tried to find out how much it would cost.
I got an estimate from $90 for my specialty copay to we don't know to phone calls that went unresponded to.
That was just the beginning of a 1.5-year-long saga where she's been hit with one confusing bill after another.
I have a master's degree. I guess a master's degree doesn't work. I need a PhD in biology.
She says the biopsy only took about an hour as an outpatient procedure. She even took pictures, but the charges didn't seem to make sense, including one for more than $4,000 for operating room services, surprising to her given it was done at her doctor's office.
I was totally shocked. I didn't have an IV. I didn't have oxygen.
Trying to get a better explanation for the charges, Carrie started calling and questioning, even going to the hospital in person.
How much running around as a patient should I have to do?
Patients deserve prices.
Cynthia Fisher has been fighting for more transparency in medical pricing for nearly a decade. She's founder of PatientRightsAdvocate.org. When Congress passed the No Surprises Act more than 5 years ago, she thought they had a breakthrough. The law requires providers to give good faith estimates for plan services and consumer-friendly cost estimators for 300 common procedures. But now, Fisher says hospitals haven't lived up to the spirit of the law.
Algorithms instead of dollars and cents. Nobody wants to do complex math when they're trying to figure out what the price should be.
This is a report from PatientRightsAdvocates.org. They looked at about 2,000 hospitals nationwide and found 236 hospitals failed to post any prices in dollars and cents at all. And even for hospitals that do post pricing, it can get very confusing for patients. Spotlight on America did our own online searching for prices at several major hospitals.
A downloadable file.
Some had Excel spreadsheets listing extremely detailed choices.
An Accolade, MRI, SR, Boast. I'm not sure what that is, but it's $13,008.
With prices varying widely.
You need to know exactly what you need to even come remotely close to getting the price.
Many hospitals did have more consumer-friendly cost estimator tools, but all of them with disclaimers requiring you to acknowledge the estimate is not binding.
Hospitals force us to sign a blank check, personally guaranteeing that we will pay whatever they choose to charge us.
For Carrie, the frustrating journey is not over. She's been making payments, but still doesn't understand all the charges.
My background was actually in HR at an executive level, and I can't figure out the Rubik's Cube.
With the healthcare affordability debate raging here in Washington, a new push is underway to force more transparency in medical pricing, and it actually has strong bipartisan support. In our next report, we'll take a closer look at the Patients Deserve Price Tags Act and find out why lawmakers say this finally might lower prices. For Spotlight on America, I'm Angie Moreski.